everyone, I'm Carla Macias, and welcome back for another episode of Best Docs Network featuring Forest Park Medical Center. The Best Docs Network show is dedicated to helping people find the right doctor right here in the city of Austin. On today's show, we'll be giving you an exclusive look at some of the amenities featured at Forest Park Medical Center, as well as introduce to you some of the physician partners a part of this prestigious group. Now let's get today's show started by introducing you to one of the Forest Park physicians, pain management specialist, Dr. Genaro Gutierrez.
I had total knee replacement on November 19th of 2013. I did physical therapy, work conditioning. I overstretched the ligaments on the inside and the outside of the knee, causing the knee implant to be loose. I was having a lot of nerve pain. Pain level from 1 to 10 was in the 7 to 8 range. My surgeon suggested pain management.
So the issue with Stephen was he
Gutierrez and I decided that doing the radio frequency on my nerves would be the best option for me because I am a truck driver and the activity I have all day long to get in and out of the truck.
Radio frequency ablation is a very focused beam of energy that is emitted from the tip of one of these specialized needles. What that does in turn is it turns that energy into heat. When that heat is created, it will lesion some of the tissues around it. The idea is if you know where your nerves are and you lay the tip of the needle right up against that nerve, you destroy that nerve. That treatment can last anywhere from 6 months to up to 2 years.
After I came into the recovery room, Dr. Gutierrez had me walk and I had no nerve pain whatsoever. I like Dr. Gutierrez, I really do. You can ask him questions, he'll explain about the treatment, how he was going to do it. I would suggest anybody with chronic pain contact Central Texas Pain Management, mainly Dr. Jerry Gutierrez.
What it means for Forest Park to be a part of the Austin community. We're just really excited to be here. We feel very honored that the surgeons have asked us to be a part of the Austin community. It's a great opportunity for the surgeons, it's a great opportunity for the patients in the North Austin medical community. What makes Forest Park different from other hospitals in the Austin area and even throughout the U.S. is that we're a truly physician-owned hospital. We are governed by the physicians who are the majority owners. So the physicians have a lot of say-so in the day-to-day operations of the hospital, from the medical staff to the OR and to the equipment that they want to have as part of their hospital that they own. We have 3 existing hospitals that are open right now and 3 under development. They're all truly unique. Every hospital serves the physicians that are participating in the hospital. Every community has a different need, and so we will serve what Austin needs and what our surgeons need. Each hospital is like a 5-star hotel, so that when a patient and a family member walks into the hospital, you really don't think that you're in a hospital. It's not a cold, sterile environment. It's very warming. You feel comfortable there. The patients' rooms are very spacious. They're very beautiful. Some of the hospital rooms actually have a VIP suite attached to the patient room. That room has a flat screen TV, a refrigerator, a pull-out bed, so family can stay overnight. The caliber of physicians that we have at Forest Park, we think are some of the best that Austin has to offer to patients. The estimated number of physician partners we have right now, we have 70 in the partnership. We have 12 different specialties involved in our specialty mix. We hope to add additional partners in the near future, as well as additional specialties. We bring the best surgeons to our hospitals. We have the best staff, we have the best service, We feel like the best hospital that Austin will have. Forest Park Medical Center is truly one of a kind.
Best Docs Network, helping people find the right doctor at the right hospital. Best Docs Network, featuring Forest Park Medical Center. Our bodies need at least 90 milligrams of vitamin C per day. The best way to get all your vitamin C is by making sure to eat at least 5 servings of fruits and vegetables every day.
It's kind of a tradition in our industry to have a celebration when the building tops out. It dates back many centuries. But really what it means to us on this project is it's just recognizing that we're about halfway through on the project, we are on schedule, and it's to thank the workers for all that they do to make this sort of thing happen. It really doesn't happen without them.
Basically, it's to thank the construction workers, the architects, the planners. We also want to thank our physician investors. They've obviously put a lot of effort, a lot of time, money into building this hospital.
Every day that goes by that I have a case that's delayed or have issues at other facilities, I just look forward to the day that we'll be able to be here in a beautiful facility and make it run the way it should be run.
I'm really excited about this project. Looking around, I can tell that this is going to be a beautiful state-of-the-art facility. And I'm really excited with the concrete steps that we've made in the progress.
We're extremely proud of the project team out here to date. They're doing remarkable on the schedule. The design has been flawless. Right now we're on target to deliver the building in February, and all crews are working hard.
We hope that this will be a project that is very meaningful to the patients of Austin because there's no question that to the doctors this is a game changer.
This is our 6th hospital we've done with Forest Park in the past 6 years. So it's been a great experience to have a partner working in an environment of trust and respect and really a true partnership.
They have a great safety record here that we're really proud of. And in fact, when I came walking up, I didn't have a hard hat on, and somebody said, "Hey, get a hard hat on."
I can't tell you how exciting today is. Just getting closer and closer. I can't wait for this place to open.
For physicians, it's all about what you can touch and feel and do, especially for your patients, and to actually see the building coming up around us obviously is very exciting.
We've gone from a dream and goals to actually really seeing things starting to happen now. Can't wait to get in here and get started.
Forest Park Medical Center is one of the top medical facilities in the state of Texas, having 5 locations across the state. Austin will soon be opening their doors in the summer of 2015. Up next, we're going to hear from a few patients and what their experience was like at Forest Park Medical Center.
I had 2 surgical procedures at Forest Park. I had bariatric surgery in September, and I've had my back surgery in April of this year. The staff at Forest Park was cordial, respectful. The checking in process was done efficiently. There were no surprises. They had called me the evening before to remind me of what I needed to do to prepare myself. I sat in the waiting room a minimal amount of time before I was called back to begin the pre-op procedure. In both cases, I was in on one day and I was out the very next day and felt very comfortable during the process.
Just walking in, it did seem like a 5-star hotel, but we were greeted at the desk by the concierge. They gave my husband a pager and explained to him what the paging system was like. They would send him a text how I was doing in surgery, where I was at, everywhere in the hospital. He was able to see at any screen where I was. And so it gave him a great sense of comfort knowing that, you know, he was being, even though it was electronic communication, that still somebody was letting him know as I moved through the progression of the surgery area, the recovery area, back to my room. He knew. It was incredible how the staff made sure that my family was taken care of while I was being taken care of.
I felt like I was in a 6-star hotel. The service was great. The people were wonderful. I really felt that I was treated as if they really cared about me and wanted to help me and get me to start recovering quickly.
And I felt really good being there. I didn't feel like I was in a sterile environment. It just felt homey. And that was nice because, you know, when you're not feeling good, it's good to be in a place that feels like home. And it was a place that felt like home. And my husband was able to stay overnight with me.
The nurses, the staff, everyone seemed really happy and ready to help you out. Where I've been to hospitals where it just wasn't like that. The rooms at Forest Park were extremely clean. The exterior, when you first see Forest Park, it does look like a 5-star hotel. Everything about it was a good experience.
Martha has a question for Tomas Antonini. How do I prevent pelvic organ prolapse?
Unfortunately, there is not much that can be done to prevent prolapse for some patients. However, there are other patients that would benefit from strengthening their pelvic floor muscles to prevent pelvic organ prolapse and also to prevent and treat constipation in order to prevent pelvic organ prolapse. The strengthening of the pelvic floor muscles are usually done with the assistance of pelvic floor physical therapy in order to correctly exercise the appropriate muscles that need to be strengthened.
Forest Park Medical Center is a different kind of hospital, designed for warmth, designed for comfort. Forest Park Medical Center is your destination to better health.
This is the Injury Report. I'm Dr. Stephen Michelsen, orthopedic surgeon with Forest Park Medical Centers. Turf toe, an injury that affects several athletes and can put them on the sidelines for weeks or even months. Essentially, what is turf toe? It's basically a sprain to the great toe involving the ligaments and supporting structures on the bottom of the great toe. The term turf toe came about with the introduction of artificial playing surfaces. The joint involved is called the metatarsal phalangeal joint. Essentially, the long bone of the foot called the metatarsal and the phalanx or the great toe. The first joint is the main joint. It's surrounded by important supporting ligamentous structures as well as tendons and soft tissues and joint capsule. Essentially, injury to this involves varying degrees of stretching, partial tearing, or even complete disruption and dislocation of the joint. Treatment of all the injuries, grade 1, 2, and 3, involve the RICE protocol. This includes rest, icing, compression, and elevation. Also included is some anti-inflammatories, and additionally some supportive devices which may include a hard-soled shoe or a boot. Grade 1 injuries typically resolve within a week or 2 weeks. These are treated with the RICE protocol as well as supportive taping and an insert in the shoe called a Morton's extension. A grade 2 injury is a slightly more severe injury involving partial tearing of the plantar complex. Initial treatment with the RICE protocol, in addition to anti-inflammatories, as well as taping, sometimes a hard-soled shoe or a boot for a short period of time. Range of motion is initiated as soon as the swelling decreases and the patient's able to tolerate. Progression into a regular shoe with an insert called the Morton's extension to provide increased stability and support to the great toe. Grade 3 injuries are much more severe injuries, can be associated with dislocation as well as bony injury or cartilage damage. These sometimes are assessed more with an MRI to assess the need for surgical intervention. Patients are initially treated with the RICE protocol, as well as taping, sometimes casting, hard-soled shoe or a boot. As symptoms resolve, patient is progressed to a firm-soled shoe with an extension, continued physical therapy. Progression to activities could involve 6 to 8 weeks or even longer. Surgical treatment involves reconstruction of the plantar plate, reestablishment of stability of the joint, occasionally fusion and correction of deformity. Although a turf toe injury may seem like a minor injury, it can sideline an athlete for several months, the entire season, or even potentially in their career. This has been the Injury Report with Dr. Stephen Michelsen for Forest Park Medical Centers.
If you haven't found the right doctor yet on today's show, head to our website, bestdocsnetwork.com, click on Austin under the Our Doctors tab. There you will find a gallery of all the different specialties a part of Forest Park Medical Center and Best Docs Network. One of those physicians you can find on our website is Austin oncologist Dr. Kevin Donor. Now up next, we're going to listen to Dr. Donor discuss lung cancer with one of his patients.
I had gone to the doctor and was diagnosed with bronchitis. The doctor gave me medicine and said, if you're not better in 10 days, come back. I went back in 10 days because I wasn't feeling any better, and they decided to do a chest x-ray. And it was that chest x-ray that showed something that concerned them. So that doctor sent me to have a CAT scan done to get a better look at it. And the CAT scan showed a definite tumor as well as blood clots in my lung. When I got the diagnosis, I was not shocked. I was not surprised because I had been a smoker for 40 years.
So Anne unfortunately represents what we commonly find in lung cancer. With lung cancer, we often don't have any sign or hint that it's there until it may be fairly advanced. So our cure rates, unfortunately, for lung cancer are not nearly as good as we would wish them to be. We're not doing as well with lung cancer as we are with some other types of cancer out there, especially the ones that we can detect early with screening tests. In Anne's case, she presented at stage 3, and we often are not able to do surgery for stage 3. Some patients are, but in her case, it was not at what was considered an operable stage. So we offered her a combination of chemotherapy and radiation, which still can be curative for many patients with stage 3 lung cancer.
The first appointment I had with Dr. Donor after I'd been diagnosed with lung cancer, I was very upfront asking questions. He looked at me and he said, I know that you'll be one of my success stories because of your attitude and you are just ready to go. And you have no idea how much that is going to help you through this process.
She received a combination of radiation and chemotherapy over several months, and so far is doing well and appears again to be in a complete remission, meaning with no detectable cancer at this point.
It's now 2.5 years later. I returned to work in August after I finished my treatments. He gave me a second chance. Dr. Donor and Texas Oncology have become my support group from day one. I can't imagine having done it without them.
Hallie was diagnosed at our 20-week ultrasound, and what they told us is that we needed to come back because they couldn't identify her palate. And so they sent us to a perinatologist. And when we saw the perinatologist, he confirmed the diagnosis, and hers was bilateral cleft lip and palate.
When we first heard that she had a cleft, it was pretty difficult. I mean, it was very emotional. You just for yourself, the things you're going to have to deal with, but also for her, the things she's going to have to deal with her whole life.
One of every 700 babies around the world is born with a cleft lip and palate. You know, sometimes we know there's a genetic component, but the great majority of the time, it just happens and we don't know why it happens. These kids are beautiful, normal in every way, but they really don't have a chance of living a normal life unless you address their facial features. And if they have a cleft palate, they need that repaired so they can speak so that people can understand them. So what we try and do is we try and get them fixed in the first year of life. That way when they get out and they start socializing and playing with other kids, you know, they're going to look normal except for a little scar on their lip.
When we met Dr. Hobart, it was actually our last consultation of the day. And we had thought we'd found our surgeon, and the surgeons we met with were great. I mean, we had confidence in all of them, and we're excited about what we found, and we thought, you know, we were just going to go in and meet Dr. Hobart. He was going to be another good one to add to the list, and we were going to go on home and figure it out. But we went in, and we both just knew.
He was somebody that just sat there and listened to everything, every crazy question I had, and really went in depth on why he does what he does, and not just his techniques, but he also went personal, and I appreciated that. And you know, he kind of just dug deeper to where you want somebody to dig, not just everything medical. You know, there's a lot of emotions with the way your child will look, and you don't want to get that wrong, and you want to find the right person to do it. And when we found Dr. Hobart, it was very obvious that that's where we needed to be.
We like to see the baby right away because we can start forming the lip and shaping the nose so that when I do the surgery at 3 months of age, it'll get a much better result. You know, I see a lot of mothers who are 5, 6, 7 months pregnant. They've had an ultrasound that shows their baby likely has a cleft, and so they're prepared when the baby's born. I'm set up so that we can begin what we call pre-surgical orthopedics, and that's just a little simple device that helps bring the gums together, helps shape the lip and the nose so that when I do the surgery it turns out much better. But I show them pictures of other babies, and we even give them mothers who have children with clefts that they can call up, and so it really relieves a lot of the potential anxiety and stress that can come without having gone through that process.
The result that you get after this surgery at age 2 or 3 months is what she's going to have the rest of her life. Obviously there can be corrections, but it's very important to get that right. Picking a surgeon is part of that, but also just as you're going about the treatment they prescribe you, the NAM in this case, doing it to its fullest extent, making sure you're doing everything that they tell you to do, and she's not going to remember it. We're probably going to have a hard time remembering it in 20 years, but that result she gets is going to be there, and it's worth a little extra headache or a little extra hardship now for a better result long term.
We love Hallie. We love the way she looks. We think that she's beautiful. It's going to be hard seeing her look completely different after surgery, but at the same time, there's just going to be so much peace of mind that we did everything we could, and she, you know, she's going to look even more beautiful. That's all that's all this is. You're just adding on to their beauty inside and out. I know she's going to be a better person because of this.
Bariatrics is the branch of medicine that deals with the study and treatment of obesity. Dr. Michael Lee is a bariatric surgeon here in the Austin area. Now let's meet the doctor.
What I find most rewarding about bariatric surgery is that it gives me this opportunity to help patients return back to their normal function. Although we talk a lot about number goals as far as weight loss and getting rid of medical problems, we also have to think about the little things. When I asked the patient why she had wanted bariatric surgery, she told me she just wanted to be able to tie her shoes and hold her grandkids. And so for her, she actually had a functional goal rather than a number goal. What I find most gratifying is that I'm helping patients live healthier and longer lives.
If you're new to Austin or just looking for a new family physician, then stay tuned because this next segment is for you. Dr. Paul John has been practicing family medicine in Austin for several years. Up next, Dr. John will be discussing a form of birth control with one of his patients. Let's take a look.
I was on different types of birth control. I tried the patch, I tried NuvaRing, I tried pills. It was hard keeping up and being consistent. Some had side effects I didn't really like, and it was just a struggle to figure out which one was right for me. I ended up talking with Dr. John about my struggle remembering, and he suggested Nexplanon for me.
Nexplanon is a new birth control device. A lot of young women don't like taking birth control pills
And some of the side effects from birth control pills, the fact that they have to go to the pharmacy every month. The only way a birth control pill works is if they take the pill. And we have patients, unfortunately all the time, who are not super compliant about taking their pill.
Essentially, Dr. John had ended up telling me that it was going to be a birth control that I would only have to replace every 3 years. Nexplanon was just really easy to deal with in my everyday life. It fit into my schedule.
Nexplanon device is a very small silastic tube which has a hormone in it which is released at a very small amount over 3 years. And it is a proven successful device that we put under their arm, usually their left arm or non-dominant arm. The procedure takes probably about 18 seconds to put in, and it lasts for 3 years. We can remove the Nexplanon device at any time. It does not have to stay in for 3 years. Sometimes people will change their minds about wanting to have children. They have the option of removing it.
I'm doing awesome. I'm in school. I've been on Nexplanon for about a year now, and I don't feel it. It doesn't affect me. The tube doesn't even bother me at all. Dr. John is just one of the most caring doctors I've ever seen. I've just felt very comfortable with him to talk about things such as this or whatever it might be. He's always very understanding and comforting. He doesn't make you feel like whatever you're going through is weird or different. It's just what's going on, and he wants to do anything he can to help.
Courtney has a question for Dr. Ray Haro. What is sinusitis?
Sinusitis is an infection of the sinuses in the facial cavity. The sinuses actually are air pockets behind the cheeks and eyes and nose. They perform vital functions. However, they can get infected rather easily, especially after allergies or head colds. Pus can develop in the maxillary sinus, for example, and this is a bacterial infection and usually requires antibiotic therapy.
The staff over at Forest Park Medical Center has an outstanding commitment to their communities as they support health-related causes. Forest Park Austin participated in this year's Austin Runners Club, the Decker Challenge. The Decker Challenge is a 5K and half marathon consisting of a hilly route throughout the countryside. The challenge is an event for all ages dedicated to promoting physical activity. So conquer the challenge. For more information on this event, visit austinrunners.org, or for more information on Forest Park Medical Center, visit bestdocsnetwork.com. Lodging provided by Radisson Hotel and Suites. Thank you everyone for joining us on another episode of Best Docs Network featuring Forest Park Medical Center right here in the beautiful Austin. Now, if you're ready to request an appointment with any of the doctors you've seen on today's show, head to our website, bestdocsnetwork.com. Got any questions or comments? Please feel free to email us at info@bestdocsnetwork.com. I'm Carla Macias, and we will see you next week.